You're watching HelloNation.
Hi, everybody. We want to welcome you to the HelloNation podcast, your voices of good news. We love good news here. I'm your host, Leah Lando, and we have an exciting guest on today who has a lot of information we're sure that you could use. Mr. Jeff Curwen. He is the executive director of the Washington State Chiropractic Association in the Oregon Chiropractic Association. Jeff, welcome to the show.
Thank you for having me.
We love to start with good news. So we want to ask you first, tell us a little bit about yourself and share any piece of good news that you have.
Okay, well, I am a career association manager. I've worked with a number of different professions, but for the last 10 years, I've been working in chiropractic. And good news is my brand new kitten, for the first time, wanted to sleep next to me last night. Got to throw that in my wife's face.
Oh, didn't want to sleep next to your wife, just you, right?
Exactly, yes. Until now, she's only wanted to sleep next to my wife.
That is definitely good news there. What's the kitten's name?
Her name is Margaret.
Well, congratulations on winning her over quickly. So, when you talk about chiropractic care, right, which you're an expert in, there are so many misconceptions. Perhaps people don't realize that they too could benefit from it. In fact, some experts say that it's one of the most important parts of care, but a lot of people don't know a whole lot about it. So we want to start by having you explain what exactly does it do?
Well, chiropractic is a whole body healthcare method. And while a lot of people think of it as just the back doctor or where you go to get your back craft or whatever, that's really just one small part of what it is. Basically, your nervous system is what controls your entire body, and it's housed in your spine. So every part of your body is in some way connected to the spine. And so by taking care of the spine, you are able to take care of all parts of the body. That's the underlying principle.
Yeah, I mean, you talk about the nervous system, obviously very important, right? What are some common misconceptions or perhaps myths?
There are two common myths that come to mind. First of all, there's one that's just the back doctor, which is not the case. It's best to think of chiropractors as neurologists. They just have a different approach to caring for your nervous system than an MD would have. The other misconception is that it's dangerous or that there's a risk in having like a surgical adjustment to your neck. There's some concern about vertebral arterial dissection, which is when there is an adjustment to the neck and a blood vessel is severed and it can cause a stroke. The thing is, that's exceedingly rare, especially in chiropractic. In the United States, there's maybe 100 cases of that a year, and only probably one or two are caused by chiropractors. And even then, there are complications that lead to it. Most of those happen by other professions that are trying to do the adjustment that chiropractors are specifically trained to do.
So you think a lot of people perhaps stay away from chiropractic care because of that misconception? They're so concerned about that potential, like very, very, very rare risk, you say, right?
Yeah, I think there's been a lot of negative press about that. I think there's been some animosity between chiropractic and the medical field historically, and that has certainly eased in the last couple of decades, but there's still some lingering tension between the two professions. The medical system did a very good job of putting out some negative information about chiropractic that wasn't necessarily accurate, but nevertheless, it stuck in the public's mind.
Yeah, and Tim, you had a question, right?
Well, it's more of a statement, like enough people play the lottery, and if you're talking about case-wide in the United States and 2% on chiropractic, you think that they'd go, I mean, that's nothing, right?
Exactly. If you think of it as those kinds of odds, that's the lottery you don't want to win, but your chances are pretty much the same as they are with Powerball.
Well, yeah, I mean, I want to play Powerball and win, but I know, I mean, I keep hoping I am, but I know I'm not. Like, I don't know.
For you.
I actually don't play it. I like the one that you play at the bar with the
Yeah, quick drop.
There you go. Thank you. Yeah.
It's quicker.
I sometimes want it that.
So, Jeff, what do you want? And people who are listening right now who say, I just really, I've seen all that negative press. I've absorbed it. I believe it. I have this conception and I can't get over it. I'm too scared. What do you want to say to them?
I want to say that it is a perfectly safe method of healthcare. If it wasn't, we wouldn't be licensing chiropractors in every single jurisdiction in the United States. It's effective. Studies show that clearly. And the fact that other practitioners are trying to take on certain aspects of chiropractic practice is evidence of its efficacy. Just letting them know that it is an alternative to the traditional medical approach. People who are tired of being pushed towards drugs and surgery for everything should look at chiropractic. As it is, I think there's a study that says only about 10% of the nation has ever been to a chiropractor even once. And personally, I think that number should be far, far higher. With me, I go to the chiropractor at least once a week. Granted, I'm in the industry, but still, I'm pretty healthy because of that.
So in this room right now, we have it's Tim, myself, and Brittany. Why should we go to the chiropractor? I don't go. I don't know, Brittany or Tim, do you guys go?
I do, and I have gone. Golf, that one hurts. Snowboarding.
Okay, so that's what brought you to the chiropractor.
When I need relief because it's so bad, yeah. I mean, I actually just watched an Instagram video. It was actually Leanne Rimes, and it was a jaw thing. And she cried because of how it relieved her. And I think of it like when I'm in pain and I've gone to a chiropractor and I'm set or realigned. I mean, I want to cry too.
Yeah, and Jeff, you say what to someone like me, but why would I go?
Well, it is supposed to be a very painless process. And then pretty much every case it is. I think maybe you were seeing some exaggeration on TV or whatnot. But the purpose is, of course, to alleviate pain, to make the body work better. But there are other aspects of chiropractic as well, nutrition and diet. There's any number of elements of medical care that can be addressed by chiropractic, and they do so without drugs or surgery. That's the number one thing that we like to point to in chiropractic is that it is a drugless form of care. And I don't know about you, but I've got an MD. I go to my MD, and every time I go there, I'll walk out with a prescription for something. Do I need to have that prescription? Had a lot of, not always.
So you don't have to be in pain to go visit the chiropractor?
No, not at all. In fact, the vast majority of chiropractors focus on wellness care. Of course, every chiropractor has somebody who comes in from a car accident or whatever, and they have pain that they need to address. But the vast majority of chiropractic is maintenance care, is keeping people well who are already.
Jeff, I got to chime in because one of the things that I really love that you've not just said but reiterated is the drug-free approach, because I know that it's an absolute epidemic in the United States, the prescription drugs and the way that they're given out, especially for pain, and to know the approach that the chiropractic associations are taking for it. I love it. I just had to chime in with that. I love that and love that you've reiterated it so many times, because I do think that is so important.
You bring up the epidemic element of it, and we all know about the opioid epidemic. And this got particularly worse during the COVID emergency, because obviously the medical side were preoccupied with COVID, and they just couldn't deal with a whole lot of the basic entry to care conditions that people were experiencing. And so the result was either those people didn't get seen at all, or they went to their MDs with their complaints and walked away with an opiate script. And that is just a recipe for disaster. What we were doing throughout the emergency was trying to educate the public about this drugless alternative that is effective, and trying to drive people into chiropractors so that they could get that relief that they were looking for, get that initial assessment that they couldn't get by going to urgent care or to a hospital or to their primary care physician, by going to the chiropractor, and then having the chiropractor escalate the issue if need be. But in most cases, they were able to effectively handle the issues that people were reporting.
What kind of patients come in to see the chiropractor, and do you have any examples of a success story that is perhaps out of the ordinary that our listeners might benefit from hearing?
all kinds of patients. It's for everybody, regardless of age or background, physical condition. Everybody from cradle to grave is a potential candidate for chiropractic. There are certain things that would contraindicate chiropractic care in very limited circumstances. And even then, it's really only going to contraindicate specific types of adjustments in certain areas. Like if you've got a pin in your neck or in your back or something like that, the doctor needs to know about that so that they are going to maybe affect that. As far as a success story, ask your chiropractor, any chiropractor, because they are always ready to tell you why they became a chiropractor, and it always starts with the first adjustment that they received. Without exception, even the people who grew up in chiropractic families, they all tell me that the reason they went to chiropractic college was because of that first adjustment that they received.
Well, let's talk about that. Is that perhaps your favorite story? What's one of your favorite examples or favorite stories?
Sure, I'll tell you my story. Like I said, I'm a career association manager. I haven't always worked in chiropractors. And prior to coming to the Chiropractic Association, I had never been seen by a chiropractor. I also spent my entire life suffering from horrible horse migraines, like almost every day. And one time, shortly after I first came on with the WSCA, I was experiencing a terrible migraine, and one of our members came by our office, just happened to see me turning on all the lights, shuttering all the blinds and everything, and just agonizing at my desk. And he comes over and he's like, "Do you mind if I just try one thing, just one little thing?" It's like, "Fine, whatever." And he makes a little adjustment, and I was like, "Okay, great, thanks." Didn't really think anything of it. 5 minutes later, migraine is completely gone, and I've been under constant care ever since. I haven't had a migraine since that day, 10 years ago.
Wow. And when you say you've been under constant care, how often do you go to the chiropractor?
It varies. It varies. I like to go about once a week if I can. I got kind of a travel schedule, so it's not always constant, but I'm under continuous care, yes.
What other forms or what other ailments can they and do they fix? What other ailments can chiropractic? Yeah, challenges.
I think of the brain. I mean, because look what that did to my mom suffered from migraines for so many years. It was debilitating. It was horrifying for her.
Essentially, any musculoskeletal condition, and also a number of neurological conditions of what affects your brain. There is extraordinary research coming out from one chiropractor in particular. Her name is Dr. Heidi Havoc. She's based out in New Zealand, but she has been putting out research on neuroplasticity for years and showing just how effective chiropractic can be in affecting the brain. Now, whether or not a chiropractor can actually directly say that they are treating the brain depends on what jurisdiction they're in. The fact is, though, chiropractic care has an effect on the entire body, and you're able to map where nerves go in the spine and where they extend to in the body, and are able to affect those by where they make the adjustment on your spine.
Is chiropractic care covered by insurance?
In most cases, yes. You'll find that most states will have some insurance coverage required for chiropractic. However, it's not uniform. Depends on what the insurance companies have lobbied for in their state. Here in Washington, it is required that every single private health insurance include chiropractic care up to a certain point. Other states, it may not be required, but it is generally available.
What things are on the horizon? Maybe you've already talked a little bit about this, or what new programs or innovations or changes are you excited about?
I'm excited about the research that's constantly coming out about chiropractic and how it supports why chiropractic is such a desirable form of care. Like I said, Dr. Havoc, her research is incredible. She works closely with Chiro Congress, which is a national organization and state associations for chiropractic. And they have a research arm through Clinical Compass, which she chairs their research committee on that. And they're constantly putting out new studies, new white papers all the time, focusing on effectiveness of care for certain parts of the body. It's really all over the map, and it's great stuff. And they're showing why it's not just for your back. It's not just for pain. It's for full body wellness.
And I know that you talked about your personal story. Any other reasons why you chose to get into this field and stay?
Honestly, I didn't come to this association thinking that, okay, this is just going to be my home forever. But when I came here, there was one thing that I noticed that was different from any other association, any other profession that I had worked, and that is the passion that chiropractors have for what they do, and more importantly, for the people that they treat. They are absolutely true believers in the efficacy of headwater that they provide, and they're able to back it up. But more importantly, they will go to all ends of the earth to make sure that their patients are done right. And you just don't see that in other fields of medicine. That's what really kept me here, was seeing that passion and being able to facilitate people coming into that form of care and getting that personal focus.
When you go out to a dinner party and you tell people what you do for a living, I know that, all of us have stories about people, their response. What is your common response, and perhaps one that either you like or you don't like or you want to correct about the field?
Honestly, the response that I give at dinner parties is what the WSCA's motto is, which is helping chiropractors help patients. I tell people that I work for an organization that facilitates care for people. We help chiropractors help their patients.
Well, yeah. So this is a game we like to call Hello Goodbye. So I'm going to read a statement. And if it's true, of course, you're going to say hello. If it's not so true, you're going to say goodbye and then explain why. And the first statement is, when administered by a licensed professional, chiropractic care can be safe for infants, seniors, and pregnant women. Hello or goodbye?
That's an emphatic hello.
Hello. So for infants.
Yeah, it's particularly common among chiropractors, particularly those who focus on pediatric care, obviously, to be present during birth and to have that initial adjustment because, the process of birth is a stressful one for obvious reasons. And it's not just on the mother, but also on the child. So they want to get the child started off right, with their body functioning at its optimal level from the beginning.
So perhaps pregnant women listening right now, what do you want them to know? Reach out to their doctor if they're interested in learning more about how it could benefit the baby, right? It's written for the baby, not mom.
Well, I mean, it's for both. But what I would suggest to the pregnant women is to search pediatric chiropractors or perinatal chiropractors. You'll find them. They're in every city. And there are people who focus specifically on care exclusively for pregnant women and for newborns.
Very interesting. Yeah, thank you for pointing that out. All right, the next hello goodbye question or statement. Care is personalized based on the patient condition and goals. Hello or goodbye?
Hello.
Hello.
Every patient is different. Every patient is unique. Just like with any other condition, everything is unique to the individual. And it's not that you're going to a chiropractor to get one single service. You're going to a chiropractor to be examined, have a differential diagnosis, find out what is wrong with your body, what's right with your body, and how to get it all back to the right place.
And once you start going to the chiropractor, you have to go forever? Is that hello or goodbye?
That is I'm going to say goodbye. Unless you want to undergo continual care, which I'm sure every chiropractor would be happy to have you because they know that you're going to get your maximum wellness by doing that. That's not that you have to be under care forever. In fact, that was one of the main myths that I thought when I first came to chiropractic, was that once you go, you never get out of it. And that's just not the case.
You have to have something wrong with you in order to see a chiropractor. Hello or goodbye?
Goodbye. You don't necessarily need to have anything wrong with you. As I said, it's also about wellness care, maintaining your wellness. There's things that you're going to do throughout your life, just normal day-to-day stuff that's going to cause inflammation, that's going to cause nerve interference, it's going to cause aches and pains, whatever. And by going to the chiropractor regularly, you are able to head a lot of that off, or at least minimize some of the those issues. So you don't have to have anything wrong with you. It can be preventive care.
Chiropractic care can be used alongside other treatments like physical therapy and medical care?
Definitely help. Chiropractic is one part of your overall healthcare team. Everybody should have, a whole spectrum of providers that they're going to, because no one provider can provide everything that you need. Chiropractors can't, MDs can't, dentists can't. You all have a certain thing that they focus on, and there's a time and a place for each one of them. And to do the best by their patient, they need to be communicated.
And if people have been listening closely, they'll know right away if this is a hello or goodbye. So by just the story you shared, it takes a long time before you start to feel better from chiropractic adjustments. Hello or goodbye.
So it's a goodbye. For me, it was almost immediate. Oftentimes you'll have an adjustment and the relief will be almost immediate. Sometimes it can take some time though. Everybody is different. Sometimes it might take a couple of days for you to actually recognize the relief that you're getting. But it can be immediate. It can be short, middle, or long term.
When people think of healthcare, chiropractic care should be in the picture. Goodbye or hello?
Hello. And it should be at the front of the picture. Like I said, there's absolutely a place for drugs and surgery. They're just later down the road. The first step should be the drugless option because it's the most natural form. Your body is inherently capable of healing itself most of the time. Catch things early, address them early, address them naturally. They should resolve themselves. If they don't, well, there's a next step that we can escalate to, and that would be where you go to the drugs and surgery. But those are later steps. Go natural first.
Jeff, it has been so great talking with you and learning so much. Before we sign off, anything else that you want listeners to understand? Any take-home messages?
Yeah, just if you haven't gone to a chiropractor before, give it a shot. Like I said, pretty much every state will have insurance coverage for chiropractors, but even if they don't, every chiropractor also takes direct payment, and it's a very inexpensive form of care, far less expensive than going to the MD or anything else. So just go check it out. See if it's right for you. I would direct them also to an organization called Foundation for Chiropractic Progress. Website is F4CP.org. Go there, and they've got a directory, and that covers all 50 states. And if you search for a chiropractor near you, you'll be able to find them. Search by specialty, by name.
Excellent. Thank you so much, sir. So nice to talk with you, and thanks for everything.
Thank you.
And that's going to do it for this segment of our HelloNation podcast, where good news travels faster. I'm your host, Leah Lando, and we will see you next time.
Thanks for watching HelloNation.